Urinary catheter validation, female patient. We first want to start by checking the EMR for the doctor's orders. And that the patient has a Foley catheter order in place. Then we're going to go to the patient's room, knock on the door, provide some privacy, do hand hygiene, and introduce yourself. Well, hi, my name is Renee, and I'll be a nurse for today. Can you please verify your name and your date of birth? Okay. Are you allergic to anything? Are you allergic to latex at all? Okay. Have you ever had your doctor order an indwelling catheter? Have you done this before? It's a simple procedure. Everything's going to be sterile. And I'll guide you through the steps when I tell you to do something so you can understand what I'm doing, okay? So what you want to do first is that you want to make sure that the patient's legs are in a comfortable position, bent at the knee, and that the urethra is easy accessible. And this is going to be a sterile field. So the sterile field, pretend that this is in a package. It comes in a package. You're going to open the sterile field, and it's going to be on the side. There is a drape inside that you're going to place in between the patient's legs as a sterile field as well. Sterile gloves come in the sterile field. You're going to first put your dominant hand, and then your non-dominant hand. You may touch the sterile gloves with the other sterile glove as long as you don't touch the edge to contaminate it. Once you have it on, you can touch as long as it's sterile. This is sterile field right here. You have to make sure that everything remains sterile. The kit comes with a lubricating agent for the catheter, povidone iodine solution to clean, a pre-filled syringe to inflate the catheter, and swabs to clean. For the actual catheter, you want to make sure that you prep the catheter before placement, since your hands are sterile, so that they don't contaminate the patient at all. You want to make sure that the pre-filled syringe is already inserted for easy access. You want to get the povidone iodine spread in the cotton balls. With your non-dominant hand, you're going to spread the labia minora to access the urethra. You're going to clean the outer edges first, from front to back, one clean stroke, on the other side, and on the center. Maintaining the labia minora open to expose the urethra meatus, you're going to lubricate the catheter, and you're going to insert it until you see urine. When you see urine, you're going to insert 1 to 2 inches more, and then you're going to inflate the balloon. Once the balloon is inflated, you're going to pull back to make sure that it's secure. You're going to attach the strap on the patient's thigh and the actual bag on the side of the rail to actually drain the catheter. You're going to assess the patient. You're going to make sure the patient is alert and oriented. You're going to ask the patient if there's any tenderness, assess the skin for any irritation. Then you're going to put the patient back comfortable in a comfortable position, lower the bed. When you're going to remove the catheter in this particular procedure, you're going to first have to deflate the balloon by inserting the syringe and deflating it. And then you tell the patient to bear down and just a clean stroke out. and then you discard everything in the biohazard field. Again, you have to document the catheter size, when you insert it and when you exert it, and when you remove the catheter, the consistency of the catheter, if there's any irritation, if you see any sign of infection. Make sure that you evaluate the urine output, the color, consistency, amount. You want to notify the provider if you sense that there's an infection. You want to make sure that the patient complaint gets brought back to the provider in case there's an infection that they can treat it. And to discard everything, you throw everything in the biohazard bag. Then you perform hand hygiene, and then you assess the patient and make sure that they can call you with a call line. And that's it.